So I've preemptively actually numbed you up. So what we do is we have little cotton wool rolls, and they get popped with a special type of topical anaesthetic. It's a little bit like Bonjela, but a lot stronger. We pop that in the corner of the mouth, and then after that we then do a classic little dental block. So the great thing about seeing an actual doctor or a dentist is that we can use lidocaine, which is a prescription-only medicine. So if you go to a beautician, they're often not able to actually prescribe that, which is why then you feel it and it's not the most fun. Whereas because we've already preemptively numbed up, this should be quite comfortable throughout. You'll feel maybe the odd pinch here and there, but other than that, nice and straightforward. So I'll just give this a little bit of a whack. So the reason the lips are red is because they're basically little bags of blood vessels. Because of that, it means the lips are the most common area to get a little bit of a bruise. Bruising will classically go away within 1 to 7 days. If you're a bit unlucky, or if you bruise very easily, if you bruise like a peach, you could get a little bit of a bruise lasting up to 2 weeks. We do our absolute best to try and avoid the blood vessels where possible. There they are. Perfect. So the first thing we'll do is just improve the projection. So the way we do that, so I'm not going to poke you, I'll just show with the needle, is we actually work along the edge, the border itself, by placing just where the red meets the white. Then it actually rolls the lip up just a touch. What we want to do is make sure that we don't work from too close to the corner of the mouth, again because that's going to roll the lip up. If you look at people with those kind of classic duck lips, it's because they've gone too laterally, they've gone too much to the side. So we come in a small amount and then we're going to be working from that position instead. The lips do tend to swell a touch, and sometimes the swelling can be a little disproportionate, so you get more on one side than the other. It will settle down nice and quickly, but you know, for the rest of today you'll find that the lips will look that little bit bigger than the actual final result will be, and they'll settle down. Okay. What that often means is for our patients who want big lips, they get a bit upset when the swelling goes down a touch, but for people who want a little bit more of a natural one, you'll be glad to know it will go down a touch. So our next thing we'll do, I'm just going to press lightly with my finger and just pull the skin nice and taut. Perfect. And then we're just measuring up. Great stuff. Perfect. And then just a moment. So count to 2, you'll feel a bit of a light pinch, and then we're on to a winner. Okay?
Yeah.
So 1 and 2 and pinch. Right. So again, you can just see the little needle tip just at the top of her cupid's bow there. Next thing we do, we hold it nice and steady, and I'm just going to aspirate. So aspirate's a posh way of saying I'm going to suck back. When I suck back, can you see that little bubble just entered the chamber? That little bubble just means that we're not in a blood vessel, because only air is come in. If there was in a blood vessel, you'd see a little bit of blood fill the chamber. So it takes a little bit longer, but it means we're super nice and safe while we work away. So here, I'm just confirming we're just here, there we are, just at the tip. And then I'm just going to ever so gently deposit a little bit. And we just...
Well done, Kate.
Right.
You okay?
Yeah, it's fine.
Yeah. So because you're nice and numb, you can kind of feel like a filling sensation.
Yeah,
but
yeah. I feel the filling, but I can't really feel anything.
Yeah, I think which is quite nice. So just gonna put.
What's the second say for Kate then?
And then 1 and 2.
No, but you're never sure if people are just being really brave and keeping us down, or if they can't read it.
So again, always safety first. I'm just going to go back a bit. Yeah, there it's a little bubble. Just gonna do that a little wipe. So I've hardly put anything in there at all at the moment. This is just working on the border. I'm going to go a fraction higher and just add a tiny little top up. So you can just see there's a little bit more definition rolled onto the edge there. We've not built up the volume at all. This is literally the tiniest little bit. I'll just put a little tiny bit more. 1 and 2 and an inch. And we'll just backfill in again, just a little air bubble. Yeah. So we just put the tiniest little bit in at the moment. We're going to go through and build more volume. This is just to improve the real roll there. Would you get to turn towards me a little bit? Just perfect. So same thing again on this side.
It's nice, like it's really soft.
Yeah.
It's not
very
really
precise.
dramatic.
Okay.
It's like in there all the time. You know, when you do stuff really like it's the microneedling for me, I think. The freshening up the skin looks so different when people have that done. Yeah.
I really want one to do.
I know, every time I see something I'm like, oh, I need to.
The lady that did it the last time afterwards, she was like glowing. We were all
Oh,
like,
at the evening, yeah.
Oh,
amazing.
yeah.
You'll see her in the videos. She's in the videos, isn't she, on the website? Yeah. Yeah.
If you look on
No,
if
on
you
the
look on the
website.
Rejuvenate website, there's videos from the last that John did last
And her
time.
skin looks amazing.
Yeah.
How old was she?
But even now, when you see her skin looks amazing. The difference is unbelievable. I think maybe late 40s, early 50s. Yeah.
But she looked like she just had like a facial, didn't she?
Yeah. Lovely. Yeah, we're all sold on that.
Yeah. We were like, you want
Bills are really massive.
So you can ask friends and family for vouchers as well if you want. And
Yeah, the
So-
videos from the last one are on
Again, I'll
the
just get to the
website.
straight ahead.
So let's have a look at the different treatments. Yeah, because there were different treatments back then. We didn't do any fillers.
at North Street.
Yes, yeah.
No, on the Facebook page,
Facebook, yeah, the
the
links on
website
there.
links on there. If you'd have gone the about bit, there's a website link in the Facebook page.
Shame I can't put lipstick on straight away to see what they look like.
Yeah, Kate.
Yeah, fine, thanks.
I think your husband might have this.
Yeah. I don't think you're going to get away with it.
we'll just add. So that was just doing a little bit of outline at the moment, and then what we'll do is we're just going to put a little bit of extra body into the actual lip itself, but just a small amount.
It's very precise, you can tell it.
1 and 2 and pinch.
I always thought it'd just be like one in and push it in.
Yeah.
So often you'll see online that people don't bother aspirating, and that's why they can be in and out pretty quick. But then it's also a bit dangerous. So we take our time, take our measurements, just add a little at a time. We can always add more, but it's much harder to take away.
You got your bag? It's in this. I've got it on the top of my head. No.
So yeah, often we'll get a little bit of bleeding, just a bit of firm pressure, and then that'll stop pretty much in just a few seconds.
So will this be tender tomorrow, or like after the anaesthetic wears off?
You'll tend to find that it'll be a little bit sore by the time the anaesthetic wears off today, but then most of the sensitivity will appear tomorrow morning. Normally it just takes a couple of days. We're just doing the top, so good thing is with the bottom lip will be nice and comfy, so when you do top and bottom and there's no rest, that's where you often feel it a little bit more. One and two and pinch.
Gabrielle out of reach. Of course, Gabrielle joining us for the magic of Christmas alongside Boyzone and Kylie and Rick Astley and Ashley Bowe and Catherine Jenkins on Sunday at the London Palladium.
And then we just check. Again, just a little bubble, nothing more.
However, if you didn't manage to get tickets,
And again, we can literally see it start to add that little bit of filler as we go. So a lot of the time it's by eye rather than looking at set measurements. One and two and pinch.
Camera on my phone is working really nice. One of the glasses next to everything will keep it in focus. With the windows, would love to do a whisper out for you if you fancy. You can text 61054. You can tweet at Magic FM, email me directly, win@magic.co.uk, or of course you can, what have I left off there, for Facebook.
And then back play, just a little bit more. And then one last little bit just on this side there, and then we'll give that a little massage and a smooth, and then you can have a little look in the mirror and see how it is. We're almost done. And 1 and 2 and pinch. Just a little.
Offer ends 3rd December, select stores only, subject to availability. I always believed in soul knit. Your new only mine at 78. Oh, I'm particularly I spend a lot of time on the album before just very
Yeah, and then I'm just going to give that a little massage and a smooth. We'll have a little look in the mirror and then we'll take it from there. You're doing really well.
You okay?
Yeah.
Yeah.
At first it will feel really quite lumpy, it will feel really strange.
Yeah.
What you'll find is, remember we talked about how it absorbs the water? As it absorbs the water it becomes a lot softer. So at first it's really quite noticeable to, I'm just going to massage this. Just get it open a little bit here. So yeah, at first all the mouth will feel is the filler, and you'll feel it, you know, like almost against your teeth and whatnot, and you think, oh my god, what have I done to myself? And then over the course of the next 2 weeks, as it just absorbs that water, and softens. And you then start to find it starts to settle to the position we want it to be, and it feels a lot more natural and more comfortable.
Stephen has joined the call.
Morning all, just wanted to say how much I'm looking forward to working with you guys.
Stephen has now left the call.
Don't cut your business calls short again. O2 lets you call and text from the UK's leading with no extra cost. Search O2 Business or visit an O2 shop.
So it sometimes takes a little bit, quite a bit of firm pressure, just to make sure we've got a nice even line. Lips often are asymmetrical, so one side can be a bit higher or bigger than the other, so we then have to try and put a little bit more on one side than the other. And again with swelling, because swelling doesn't happen evenly, sometimes they will feel a little different. I am going to put a tiny little bit more just on this side, because this side ever so slightly bigger. We don't want to chase the swelling. Sometimes you'll find people will try and make it all look even, but we know how much we've put in everywhere, and we want it to be balanced basically. So no one, the classic thing is not to panic and think, oh gosh, this is a really nice result. Don't worry, this is just for general reference. Often you'll find inexperienced injectors will end up putting a lot more on one side than the other because the lips swollen differently and they're chasing the swelling, whereas just be confident in the measurements you've done and whatnot, and then you're onto a winner. Get open for a second. We'll just do a little bit of thumbing, so we actually enter more in a downward motion this time.
What is this that you're doing?
So fanning, when we're trying to get to a certain position and you start from the actual top of the Cupid's beak, you can literally enter just at this point here, drop straight down to where we need to be, and this time we inject in a vertical line, and it just causes the lip to just raise just a touch there. And we aspirate for safety. Let's see if we again. 1, 2, 3.
Missing you, John Waite, it's Mellow Magic, Wednesday evening, and Alistair's been in touch. I always like to know what Alistair's going to eat, and suddenly, it's disappeared. Here it is. Cooking veggie paneer skewers, whatever that might be.
Oh, please feel.
Perfect. There we go. And then I'll give that a massage, pass you a mirror, and then that's all done.
Yeah.
Just sit you back up, I'll pass you a little mirror. And then onto the winner. I say I'll pass you a mirror, there you go. So in terms of the lips there, just get a little bit of tissue. So we've enhanced the height of them, so you can see they're that little bit taller in terms of their height themselves. And then also that a little bit more upturned prominent there, but it still looks like a lip. We've still got that little cupid's bow. Yeah, a really quite nice result there.